Governor Tucker was admitted under the care of the hepatobiliary service of the Rochester Methodist Hospital of Mayo Medical Center on Monday, August the 9th, for management of gastrointestinal bleeding. The bleeding was related to dilated veins in his esophagus, and that is the swallowing passage, and this resulted from increased pressure in the veins in relation to the liver. The cause of this increased pressure in the veins is primary sclerosing cholangitis, which is a condition associated with ulcerative colitis, a condition for which the governor has been previously treated. The governor is stable and in good condition today and has been moved out of the intensive care unit to a private room. The monitors have been disconnected and he is walking about and is in good spirits. If he continues to progress the way he has, it is anticipated that he will be dismissed towards the end of this week. Primary sclerosing cholangitis is a slowly progressive liver disease, and many patients ultimately require liver transplantation. The governor is not at this time admitted for liver transplantation, and neither is he on a list awaiting liver transplantation.
Let me just go over that one more time. We've heard reports down in Arkansas that yes, he has been on a list for a number of years, and that he continues to be on that list. Would you dispel that report once and for all? You already have, but do it as emphatically as you possibly can.
He's not on a list awaiting liver transplantation at this time. He never has been on a list at the Mayo Clinic.
Do you anticipate in the near future that he will need a liver transplant given his condition?
Patients of primary sclerosing cholangitis, as I indicated, some of them ultimately come to liver transplantation. Ultimately, he would come to liver transplantation. When that period is, it's difficult to say. Ultimately, there is always the possibility that he will come to liver transplant.
Are we talking years, months, weeks away from that ultimately?
That's again difficult to say, but based on the way he has progressed over the past few years, I would say that's not in the very near future. That's not likely.
Has the governor ever been treated here at Mayo in the past? I have a report or a question I'm supposed to ask about treatment around 6 years ago for either colon cancer or a problem with his liver.
He has been a patient of at the Mayo Clinic since 1988 when he was diagnosed to have this liver condition. The surgery for the colon was carried out at the Barnes Hospital in St. Louis, and that was by Dr. Jim Becker. From our records, we have nothing to indicate that that was done for colon cancer, that was done for ulcerative colitis.
Other than that, he has been coming back to the clinic here for checkups.
That's right.
And prior to this incident, had there been anything that was unusual in his treatment here or his checkups?
No. Dr. Raleigh Dixon is his primary physician. I've talked to him and I've reviewed the records. And again, there's nothing to suggest that he was behaving different from our usual patient with primary sclerosing cholangitis.
I was led to believe that he was going to undergo a number of tests today to see if he would be a candidate for a liver transplant. Is that accurate? And if so, is he a good candidate?
He's not undergoing any tests at the moment with the view of liver transplantation.
You mentioned that he is not on the Mayo Clinic transplant list. There is another organization, or there are other organizations do you know about those lists or not?
You know, we can vouch for what's at the Mayo Clinic, and he's not on that list. But since his care has been here, if he was going to be on any list, it would be the Mayo Clinic list.
What are his prospects for returning back to active life as governor of the state? Have you recommended to him that he scale back his schedule, given his condition? Is his life threatening at this point? Give us a sense of what you've recommended to him.
Based on the way we've been treating patients, we have a certain list of recommendations. There would be nothing in his condition which would prevent him from going ahead with normal activity. Further details about exactly what we might recommend to him I would think that part of that would certainly be confidential. But based like any other patient who has a problem like this, we don't really anticipate that there's going to be a problem.
Is Dr. Dixon coming back just to look at the governor?
No. Dr. Dixon is away, and he's due back here on Thursday. He's back at work on Friday. That was something that was planned. Well before this.
Can you give me a sense of how gravely ill he is or has been? I mean, you don't find yourself in the ICU of the Mayo Clinic unless you are very sick. Is that an accurate interpretation?
He came in with a gastrointestinal bleed, and anyone with a gastrointestinal bleed related to liver disease potentially is at a risk for complications related to the bleeding. So he was admitted for blood transfusions for control of the acute bleed. When he came in with a bleed, we'd say, yes, his condition was critical, but we've got over it fairly rapidly and he's stable now. But, really the bottom line is, would a person in the intensive care unit who's admitted in the intensive care unit, would that be someone who's critical and needs to be watched carefully? And the answer is yes.
Can a patient, given that experience and given the ultimate or the inevitable need for a liver transplant, return to a fully active life, or do you recommend against doing so?
Based on our recommendations for every other patient with this problem, and with this amount of liver function, we tell them activity and diet really as tolerated. We don't restrict activity at this time.
What percentage liver function is that?
That's something very difficult, to quantitate. Liver function is something very difficult to quantitate. We don't have any good test. We watch liver function over time and we watch the progress. And over time there has been some, but like I said, the way he's progressed over time, the change has been slow. And patients with primary sclerosing cholangitis progress. And there has been progress. But it's difficult to quantitate. I cannot give you a percentage. No one can give you a percentage change.
This is a life-threatening condition, though, is it not?
He's had a bleed, which we've controlled. Untreated, that's different. So, there are a lot of conditions which are life-threatening, untreated.
Aside from the intestinal bleeding or from the bleeding of the esophagus, his liver condition in itself is life-threatening, no?
Not at the moment. His liver condition, as I'd indicated, has only progressed very slowly, and that has been stable in terms of function over the past year or so.
Can you give a timeline on this? Is there any way to foresee?
Absolutely no way. There's no way. All we know is that...
Could he live the inevitable course of his life? I mean, could he live to be an 80-year-old man and pass away in his sleep? Or is this something, will the liver eventually claim his life?
That's where we have to decide about liver transplantation. When we decide that this liver is not enough to keep him functioning normally, we have to decide about liver transplantation.
And one thing about that, when that does come up, tell me a little bit about the course, how one goes on the list, how one is prioritized on a list. Given the fact that he's a governor, does that change his priority standing?
We decide on transplanting a patient based on several factors. We look at what we call synthetic function of the liver. Is the liver producing the things it's supposed to produce? That's one. Second is we look for complications related to the liver disease which we are unable to treat. It's a second. And third is the quality of life. So based on these three, we decide whether a patient is a candidate for liver transplantation. Then they undergo a series of tests, at the end of which they are accepted as candidates for liver transplantation. And then they are put on a waiting list.
Will he move to the top of that waiting list because he is a governor?
I don't think he should.
It's a recommendation of the Mayo Clinic that he not be given priority because he's a governor.
It's not up to the Mayo Clinic to make that decision.
It's a national organ sharing system, so we don't make those decisions.
We've reached a time when we need to stop. I appreciate you coming out. I know it was spontaneous and impromptu. I appreciate what you can do. Thanks very much.
Thank you.